Mayor Lovely Warren is encouraging community members to sign up for health insurance under the Affordable Care Act and offering help to anyone needing to enroll. Jennifer Burns is a librarian in the Division of Business and Social Science at the Central Library of Rochester and Monroe County. She joins us now to tell us more. Hi, Jennifer.
Hi, thanks for having me.
Thank you for coming on. For those that don't know, what is the Affordable Care Act?
The Affordable Care Act, which is also known as Obamacare, provides health insurance to those who do not receive insurance from their employer or don't qualify for Medicaid or Medicare.
Okay.
It also provides tax incentives for smaller businesses that traditionally have not offered their employees health insurance. Also, if your employer provides health insurance, but it's not financially viable for you, if it costs more than 9.5% of your income, then you can qualify for the exchange as well.
Okay, and when is open enrollment?
Open enrollment started November 1st and goes through January 31st of 2017.
Okay. What sort of help is available for people needing to enroll, looking to enroll?
There's help via the New York State of Health website. You can also call their toll-free number, and also there's certified healthcare navigators who are there to assist you in filling out the forms and selecting which health insurance product is best for you.
And that's going to be happening at the Central Library as well as some of the other branch libraries around the city?
Correct. Throughout open enrollment, there will be places where people can meet with a navigator.
Okay, so along with Central, what are some of the other branches that are offering services?
There'll be Lincoln, Sully, Highland, and I think that's it.
Okay, and all those times are listed on the city's website?
They're on the city's website, and they're also on the libraryweb.org website under libraries, under healthcare navigators.
Okay. What does one need to do to prepare to come in to work with the healthcare navigator? Do you need to make an appointment?
You don't need to make an appointment. Everything is first come, first serve.
Okay.
And they're there for over 6 hours usually. So you will, if they're there at the library that day, they're there for the whole day, and you will be able to get in to see them. You need to bring your last year's tax return. You need to bring photo ID. You need the dates of birth and social security numbers for all members of your family that you wish to enroll.
Okay. And what sort of partners are helping with this effort? So we've got the city, the library.
Law New York and Trillium Health they provide navigator services.
Okay.
It's important to go through an organization such as those, because a lot of the insurance companies also have navigators.
Okay.
So if you work with Trillium or Law New York, you know that you're getting unbiased information. MCC is also involved in helping people enroll.
Okay. What sort of training does a healthcare navigator need to go through and be certified?
They go through a very intense 2-week program through New York State, and they need to pass tests to be able to be a navigator.
Okay. When someone comes in for help, how long should they expect to be there?
They should expect to be there at least an hour.
Okay. Is the only way to enroll online, or can you do that over the phone?
You can enroll over the phone, and over the phone they have over 25 different languages to choose from. So if you're a non-English speaker, you can also call them and request a printout of the form. That's going to obviously take longer for you to fill out and return back to them, or you can do it online. Okay.
So along with the language line on the phone, are there also opportunities for people to come in that speak Spanish, or there Spanish interpreters at the library?
Some of the navigators speak Spanish, and it's indicated on the library's website which ones speak Spanish. There'll be an S after the date and time so that people know that that person will be there is bilingual.
Okay. What are some of the questions that people come in asking navigators?
Typically, they want to know, I don't need health insurance right now, but what happens if I need insurance after open enrollment? So if you have any qualifying events such as divorce or you lose your job, you can still enroll at any point as long as you have one of those qualifying events.
Okay, that's good to know. What should people consider when they're selecting a plan for themselves or for their family?
They need to think about what's really important to them in terms of health care. Do they want to stay with their primary care physician? Is it more important for them to have lower copays at specialists, or do they really want really good drug coverage? So it's looking at each family's, basically your health history and what you know are going to be your highest costs and deciding from there.
What happens if you miss the deadline?
If you miss the deadline and you don't have a qualifying event, then you'll have to wait until open enrollment.
Okay. Are there more healthcare navigators needed? Are there volunteer opportunities for people in the community that maybe just want to come out and help?
There aren't any. They do need more navigators. However, the state doesn't have the capacity to train more. There's a lot of people who are willing to become certified application counselors, but there isn't capacity at the state level. We don't have volunteers come in to help that aren't trained application counselors.
Got it. Okay. Why is it so important that people or individuals enroll in a plan and have health care?
Because prevention is the best medicine, and it prevents people from showing up to the ER for really minor things. So that makes our ERs work much more efficiently and for the purpose that they serve. And also, if we can prevent someone from getting sick, it is much more cost effective.
When people come in for enrollment help, is that a free service?
That is a free service, yes.
Okay. And how is that? How is the library able to provide those services?
The agencies such as Trillium and Law New York, they actually approached us and said, we would like to meet people there at the library, because they know that people trust the library, and they're less afraid. It's somewhere that they already go, so they don't have to go to a new building and a new location. So it's convenient for everybody.
That was kind of going to be my next question: is why the library? Typically we think of we go there to check out books, use the computer. Why the library as a resource?
Well, when the Affordable Care Act was rolled out, and they encouraged everyone to apply online. However, the people that really needed to apply online didn't necessarily have internet access. So if you want to apply and you need a computer to do that, you need to come to the library. But also, again, because it's convenient, they trust the people that work there, and they know that whoever's there as a navigator has been vetted and is in their best interests.
So are the navigators volunteers? Are they paid for their work that they do?
They are paid. They're paid by the agency that they work for.
Okay. What would you say to someone to encourage them to take advantage of these services?
If you're young and you think, oh, I don't need that, you do. People under 30 can get catastrophic coverage, but you never know. You never know when you're going to need it, and you want to be able to financially, manage any health issue that arises.
Sure. Why is it so important for Rochester?
We need a healthy community, and people that call in sick, it decreases productivity. It costs more businesses more money each time someone calls in sick. And if you put off seeing a doctor, and then as a result you miss more work because it's too late to do prevention, then again that really impacts the economy greatly.
So services have already been started at the library. There's plenty of open hours, but people kind of tend to wait till the deadline.
Yes.
Do you discourage that?
We try to discourage that,
Okay.
yes. So because if everyone comes in on the last day and there's only one navigator there, and there's only so many hours in a day. So, and again, it can take up to an hour, at least an hour to enroll someone. So please don't put it off is, what we like to reinforce.
Sure. How many navigators do you have at each session at
There's
a time?
one navigator at each library when they're available.
So really important to
Yeah.
get in before the deadline. Thank you so much for coming on, Jennifer. If you'd like more information about enrolling in a healthcare plan under the Affordable Care Act, again, you can visit cityofrochester.gov/ACA, or